my name is Donna. I had 2 total hip replacements with the direct anterior approach. The first one I had December 21st and the second on February 1st of this year. I waited as long as I possibly could to have hip surgery because my mother had had 2 hip replacements, and this was like 30 years ago, and so she had the old traditional method, and I watched her go through both surgeries, and it was not a picnic, so I decided I would tough it out as long as I could. And the other reason I did that was because I had heard about the direct anterior approach, which was minimally invasive, and there was a much faster recovery rate. And I have a son who is very busy, and I thought if I have to spend 6 months recuperating from each surgery, that was not going to be doable with an 11-year-old. So my life was centered around a leave, when I could take it. And so I went in on December 21st, and I think because I was in so much pain before I went in, that when I came out of surgery, it was like the pain was gone, and it was like a miracle. And when they said, well, let's get you up and see if you can walk, it was like, that's no problem, and I'm just 4 weeks post-op from my second surgery, so I think that's pretty good, and, I'm hoping that it'll be uphill from here. I notice every day I'm able to do more, and yesterday I got the go-ahead to be off my cane, so I'm really excited. Last summer I did a garden, and, it was difficult planting it, and problem was that I couldn't step over the rows of plants. When I stepped down on my leg, I couldn't count on my hip to hold me up. So I'm really looking forward to going out and planting the garden and being able to harvest it with no problems. And I'm looking forward to riding a bike. I'm in physical therapy. I'm riding the bike every day. I really can't think of anything but good things to say about Dr. Faure, about the nurses, the physical therapists. I had my surgery at Aurora Grafton, and both times, they were amazing. I think perhaps people wait longer than they should because they're afraid, and I think we have so many options. Direct anterior approach was definitely the right way for me to go because of my needs, but there are lots of other methods that are minimally invasive and, may work just as well or better for other people. So, there just isn't really a good reason to prolong your pain if, when you have so many good options.